Thank you so much that being with us on this platform. A talk between a psychiatrist and us that will help us to get some insights wherein an endocrine gynecological disorder, which most of the time affects women, and that too, if we look at the prevalence, it is 1 in 10 women who suffers from PCOS. The term itself says Polycystic Ovarian Syndrome, which becomes a multifactorial and quite a challenging for a metabolic function of the body, which increases the obesity, resistance to fat metabolism, and indifferent eating habits and mood swings. And also, it affects the skin texture, everything. So, a woman who is in her adolescence until she becomes a young, till she reaches her puberty, she faces acne and many other challenges, which a society may not accept her that because till date in India, what we see from a women perspective, a fair lady with a beautiful hair, good skin texture is always an adorable. So, what women should do when she faces a PCOS and these challenging situations, how to combat, we would like to understand from you. So, one of
Right.
the TED Talk also said we cannot truly empower women without solving their health problems and, importantly, a mental health problem. So, let's focus on PCOS and how, in general, it affects a women. And is there any connection between PCOS and mental health of a woman? Ma'am, would you like to share your insight over this?
Yes. As you already explained, the basic biology between PCOS and the various manifestations of this condition, um, it it has been found in studies as well as in our clinical practice that women with PCOS show a very higher incidence of some mental health conditions like depression and anxiety. The ratio of the incidence of these disorders in women having PCOS is almost 40-50% higher than the general women population. Right now, it has both biological basis as well as psychological basis. So, psychological basis would be that the fact, like you said, that they are extremely conscious about their appearance, as PCOS has been found to be significantly associated with hirsutism, that is increased facial hair, obesity, excessive weight gain, and also a lot of acne. Right, so they become extremely self-conscious. Sometimes they are probably made fun of in certain age groups. Points of being rejected or being looked upon, observed, all these factors kind of cause an increased anxiety, which is also a social anxiety. They kind of start avoiding going out of their houses, meeting people, and all of these add on to the burden of depression. Now, this is the psychological basis. Coming to biological basis, uh, due to PCOS, it is associated with a lot of hormonal imbalances. So, the hormonal imbalances, along with a lot of inflammatory markers going up and down, these also have a biological basis for anxiety and depression. It is very well known that even in women without PCOS, during their premenstrual phase or during the pregnancy phases, during menopause phases, the incidence of depression, anxiety, and other mood changes and mood swings is very high. Going by the same logic, PCOS is kind of a persistent situation of the same conditions. So, their incidence of a proper disorder form in depression and anxiety has been significantly high. It also leads to certain eating disorders like anorexia and bulimia. Again, because of the weight gain issues and the appearance issues. So, that's the reason why women with PCOS need to be evaluated, and they have special importance from their mental health perspective, because as it is, they are facing with a lot of stress from their physical issues.
Yes, ma'am. So, we have read in many epidemiological studies that a high prevalence of anxiety, depression is being reported in women, and that too at a quite a lower age group, that is an adolescence, just a beginning of puberty. They have not even reached the proper cycles of their menses, but still it indicates that there is an increasing need of a mental health expert who can consult them or counsel them. So, what would you like to suggest on the same? That PCOS generally be advised with the proper consultation from a psychiatrist, or they need someone who is on a just a mental health expert or a meeting a gynecologist also resolve their problems.
Right. So, like I said, that this starts from an adolescent age group, continues till their entire adulthood, and in each phase of their life, they face with various kind of challenges. For example, in the adolescent, probably their primary concern is their appearance and the way that they are standing out of the entire group. They also experience a lot of mood changes, because of which kind of comes in the way of their peer relationships or their social relationships. As they grow, when they reach the adulthood or after marriage, they also face issues of infertility or subfertility, which in itself becomes a huge cause and concern of anxiety and depression. So, I would say that for the treatment of their mental health issues, it can be addressed in two phases. One would be the preventive approach, and one would be the curative approach. Curative approach, as the name sounds, when they do come for any kind of consultation with a gynecologist or with a family physician, we need to pick up these subtle symptoms of anxiety and depression, and it is better to refer them to a mental health professional. A consultation with the psychiatrist, followed by, if required, counseling sessions by a psychologist, would bring significant improvement in their mental health. And once the mental health improves, the physical health, the motivation to work on their physical health will also improve. Coming to the preventive approach, I would suggest that it would be a good practice if the moment when there is the first contact with a medical practitioner, be it a gynecologist or a physician, if once they are diagnosed with PCOS, for their general mental health condition, also if they are referred to a psychiatrist, it would be better to pick on the early signs or work with them to bring about the necessary lifestyle modifications, which can, enhance the positive mental health. There is a concept called positive mental health, wherein we do certain things
Yes.
to build that resilience, mental health resilience, to work with, because anxiety, depression, stress, all of these things are very rampant these days, right? And PCOS adds an external baggage to this, and it worsens the situation. So, a general time to time consultation with a psychiatrist for the general mental health well being, just how we go for a regular physical checkup, annual physical checkup or annual blood health work, which we do. That's a normal practice. What we need to do is normalize the concept of going for an annual or a 6 monthly mental health checkup as well. If we can include this as a part of their routine medical practice or medical checkup, it would help us in preventing a lot of impending anxiety, depression, mood disorders, and a lot of mental health other issues that they face if they are picked up on time.
That's perfectly you have touched upon all the repercussions which happens because of PCOS, and I like the term what you said, an extra baggage which gets added to women's life when they face such challenges, and whom to consult, where to go, whether it is the same for everyone. That everything has been touched upon by you. Thank you so much for this. But I would like to still ask you: would you like to share something as a final take-home message to all the women and all the viewers who would like to gain that insight ki what, when, and how to do it as a part of to reduce these struggles. These are all struggled areas for a woman, an adolescent girl, whoever is that, or a woman who is facing challenges because she has never came to know that she is facing PCOS, and suddenly post her wedding she started facing infertility, the most challenging part. So what would be your take home message on this?
Yeah, so I would say that for any woman who has been persistently noticing a change in their mood or their basic anxiety behavior, if they feel a persistent change or rise, and they are finding any kind of irregularities in their periods, in their menstrual cycle, or if they are finding that the their weight gain or the metabolic side effects are significantly high, recurrent acne, facial hair growth, being extremely avoidant in the regular situations. So I would suggest that they need to consult a mental health professional at the earliest. to get a better knowledge or a better understanding about why they are facing these situations, and we need to normalize the existence of such situations. Because the acceptance that, okay, what has happened to me, why is this happening to me, that thing has become so okay, I am out, I'm outcasted from the entire family, or my friends are not having this in the family, nobody else is facing this, why am I facing it. So we need to normalize that concept, because once they visit a professional, they get a proper biological basis of why these problems are occurring, and there are proper solutions for it, right? Also, we would want them to develop certain healthy coping mechanisms, because this is a stressful situation. PCOS is known to cause a chronic stress in a woman, which starts from their adolescence, kind of continues till their adulthood, and maybe to their later half of life as well. So, when you visit a psychiatrist or a psychologist, not only are you working on the existing problems, but what you work on is developing a positive mental health, and developing stronger coping mechanisms and a better mental resilience.
Thank you so much, ma'am. It was quite an effective therapy, what you have said, and the theory behind this PCOS. This will definitely help all the viewers and the practicing physicians to deal with these PCOS challenges, which when come to them. Thank you so much.
Thank you.